I'll introduce you and then you can start your presentation.
Sure.
Aisha, we can see. I'll introduce you and then you can start your presentation.
Sure.
Okay. We're live right now. Okay, let's wait a couple minutes and then we can start. Hi, Sam. This time it's not on Zoom. We thought it would be better to be on live, but maybe in the future. Okay, so perfect. Let's get started. So hi everyone, thank you for joining us today for our virtual dental shadowing session. We wanted to remind you that in order to get your hours, you'll have to take a short quiz at the end of the session, and as long as you get a 3 out of 5, you pass and you earn your hours. If you are a returning shadower, please go in the link of our Instagram bio and you will see your number, which will be for your test. We are very fortunate to have Dr. Mundiya for our shadowing session. So I'm handing the mic to you. So let's get started.
Hey everyone, hope everyone could hear me. My name is Junaid Mundiya. I'm one of the chief residents at Brooklyn Hospital Center, and my specialty is oral and maxillofacial surgery. As most of you guys may know that dentistry encompasses many different specialties such as general dentist, periodontist, endodontist, orofacial surgery, pedodontist, and a couple of more. Sorry about that. So I'm gonna just dive into my background. Again, my specialty is oral and maxillofacial surgery. From what I understand, this virtual shadow is nationwide, not even nationwide, worldwide. So in Europe, they have two different parts. They have oral surgery and maxillofacial surgery. But since I'm in U.S., we encompass oral and maxillofacial surgery as one specialty, as a 4-year or a 6-year program and an MD option. I'm in a 4-year program, so I'm not getting an MD, but same training. I did my bachelor's degree in anthropology with minors in chemistry and bio at CUNY Queens College in New York. And then I went ahead and went to Philadelphia to Temple University for my dental degree. At that point, I realized that I want to do something a little bit more encompassing medicine and dentistry together, which brought me to oral surgery, or OMFS. I ended up doing an internship in Chicago at Cook County. And then since then, I've been at Brooklyn Hospital Center, where I'm rotating at different hospitals, St. Barnabas, Geisinger. And this is my last year, so I'm like about 100 days or 110 days left to my residency. And I signed a contract in private practice, which is the Suffolk Oral Surgery Associates. Again, I encourage you guys to ask questions. If you have any questions, put it in the chat box so you don't forget them, and then we can always go over them. I'm using so I was asked, studying tips and advice of staying motivated. I think this is the biggest, factor that comes into play of any pre-health, pre-science or science major. It's tough. It's hard. You have to put a lot of hours in, and you'll be learning about embryology or microbiology, biochem, and you're like, I'm never going to use this when I become a doctor or when I become a dentist. True, in some ways, but it's the basic. It's the basic that counts. Again, you have to stay motivated. There are going to be people around you. There are going to be people, friends, family, classmates, or people you see are just going to tell you why spend so much time and energy, and or you're not going to make it. But if you're dedicated and if you're passionate about that subject, or that goal, you are going to make it. I mean, I myself had a couple of people tell me that it's not worth it. Everyone stops pre-med, but I didn't, and I'm here. Everyone has a different style of learning. See where it works for you. My style changed every other year. Sometimes I would just cram study just to pass the exam. It was good because I studied only 3-4 days before the exam, and then but the worst part was as soon as the exam is over, I forgot everything. Uh, I don't think that's the best way of studying. Thing going every day and studying a subject every day, or dividing it up works the best. And I think I did that for my organic chemistry class in undergrad. That really helped out. I would every day I would spend 2 hours studying, and then during exam time it was smooth sailing. I really didn't have to study because everything built it up upon each other. Dental school is a different animal. You are just surrounded by so many classes, and every single classmate you have is passionate. They're studying, they have this, you were cream of the crops in undergrad, and then you made it to dental school. Now you're competing, or you're studying with students who are pretty much the same uh, skill level as you are, and you're more motivated. Some are more motivated than you are, and you have to just feed off everyone's energy, positive energy. There are going to be some negative people, so you have to just look at the positive energy. Residency, again, things always get harder. If anyone tells you that things are going to get easier, in some ways, but overall everything gets a little bit more confusing and challenging, but you accommodate and you learn how to be better. uh, in residency, you have a work style. You're working 12 to 14 hours a day, and then there's a surgery next day that you need to study about, that you need to just learn about it overnight, and you just have to look at it, watch some YouTube videos, and just go after it. So everything builds up on each other. So the habits that you have in high school and undergrad, dental school, and residency, it builds on. So that's why you need to get in a good habit from the beginning. Just don't cram and forget. Uh, there are going to be days that you're going to be unmotivated. There are going to be days that you're going to fail that exam, or you're not going to get the grade that you wanted, or it's just going to be a bad day. But put set your eyes on the prize. It takes time. I had to do a non-categorical internship to get into oral surgery. I don't know how I got lucky that I got into dental school right away, but if you keep your eyes on the prize, if you know what you want and you're passionate about it, you'll get it. Also, don't burn out. Take breaks. Breaks are much needed. You need to go for dinners with your friends. You need to hang out with your family. You need to just take a step back from studying sometimes and be like, all right, I'm I'm mentally exhausted. I need to just take a break, and you should, because that's very important. It's going to help you not burn out. It's going to help you come back to the subject and matter in a different point of view. You're going to look at things. You're going to look at problems. You're going to look at study material and be like, oh, this didn't make sense before, but now it does. So I would definitely encourage taking some break in the middle during the day, and the most important thing is surrounding yourself with positive people. You might have your best friend, but if that best friend is negative and they're bringing you down, or they're just demotivating you or not encouraging you to study, I mean, it's not worth having people around you that are going to bring you down. So surround yourself with positive people. That's really important. uh I mean, since all of you guys are here, you guys are passionate about this subject, passionate about dentistry, passionate about pre-health. uh all the board members, everyone, you put this together. Community service is important. What contributes into community service? You could tutor, your lower classmates, you could help them out. You just starts with just giving someone a hand, being a positive role model to someone else, and then slowly you develop into, people see your professors see you, and they're like, oh, you know what, you might make a good tutor. Why don't you help out these bunch of people and help them out? I think I did some chemistry and bio tutoring. Sometimes I think it was required for our honor society, but sometimes some people came in, sometimes no one came in. Pre-dental club. It's really important to know about the specialty. A lot of people, at least myself, when I first thought about dentistry itself, I thought of, I'm going to become a dentist, I'm going to start a business, and I'm never going to be associated with a hospital. And I'm just going to go in, drill, fill, clean, implants, all that stuff. And as I got in, or as I matured in my career, I learned about the different specialties, and I learned about oral facial surgery, and I just got so into it.
Hi, Doc. I think you froze. Sorry, guys. I think he froze. We'll be back right now. Sorry for the inconvenience. We're gonna message him right now privately to see what the issue is. Hang tight. We'll be right.
Hey, did I disconnect?
Yes, Doc. You disconnected.
Oh,
Why? Hi, Doc. If you want, yeah, we can see your screen right now.
okay. Hey guys, I'm sorry. I don't know what happened. It seems like disconnected. Uh, so was I on this slide when they got disconnected, or? Yeah, so like I said, be a part of organized dentistry. It's pretty important to have your voice count. Choosing a specialty, how did I choose my specialty? I'm just going to talk about oral and maxillofacial surgery because that's the best. I mean, I could only describe myself and my specialty. Uh, like I said, I really enjoy the surgical aspects of things, working with your hands, working with people, working with patients. But at the same time, one of my cousins, or one of my second cousins, actually told me, rise to the top. And if any one of you guys are in dental school, you always see, like, the oral surgery department is like, they're looked upon as one of the most prepared department. And if there's a medical emergency or anything like that, if anything happens, call an oral surgeon, do this or do that, or get the oral surgeon involved. So that got me really interested in oral and maxillofacial surgery. You had your good surgical background, and then you had your medical knowledge. Uh, I have to say, I spent a lot of time, energy, and sacrifices trying to get into this specialty. Uh, some days were long. Some days it was hard just to get in, and I'm still sharing, right?
Yes, just
Oh,
press that.
all right. So some days just things were very difficult. And you're in the hospital setting. You're not in a dental school. You're not in a dental clinic. It's a different environment. It's a different people you're surrounded with. You're surrounded with nurses. You're surrounded by doctors, PAs, medical residents who see you as just a dentist. But then you come in and knowing. I mean, now I'll show you exactly the things that we do. It shows us that we're actually a huge part of a hospital, a huge part of a trauma team. Uh, and if I didn't get into oral surgery, what would I have done? I have no idea, but I could tell you that I really enjoyed all aspects of dentistry. The only thing I really, really probably hated the most, and I hated doing it, was cleanings. I just, and when you're a dental student, you have to do everything yourself. You have to, I mean, there's no hygienist or anything like that that's doing your cleanings. You had to do everything, and that was one thing that I just couldn't do it. Uh, these are the common dental instruments that are used in oral surgery procedure. If we were if we were just more interactive, if this was more interactive, I would have quizzed you guys what these are. But these are some of the forceps that you take out, or in lay terms, people, these are the pliers that you use to take out. But that's not what we say in dental lingo. These are forceps. And these are what they call elevators. They are help to loosen up the teeth, to remove them. Of course, your dental syringe, your dental mirror, and some of the probes, curettes, and periosteo elevator. I think this periosteo elevator right here, this is the workhorse of oral maxillofacial surgery. I believe if I have this instrument and this instrument, I could do almost any single procedure that I want to do in a clinic setting. What's a typical day like in residency? I'm only going to speak about residency since I'm a resident. And then it could vary in two different ways. Day one talks about if you're in the operating room, and day two talks about if you're just in the clinic. And what I'm talking about is from a chief resident's perspective. Of course, when you're an intern, you're on call, you're in the hospital all the time. You have to round, you have to do post-operative checks, you have to see these patients. Just like, if you watch Grey's Anatomy and how these interns work, exact same ways, right? So day one, from a senior resident's perspective, you come to the hospital, and your lower level interns has already rounded on the patients, has a list ready for you. You take the list with the whole team. You round around 7 o'clock, 7:30, depending on what's going on, or what's the plan. Then if you have a surgery scheduled, you go to the operating room. Cases could be as long as 8 to 10 hours in the OR, one case, or you could have multiple cases, 2, 3 cases. In each case is around 2, 3 hours. After you're done with the OR, you go ahead, you sign off to your intern who is on call, or your lower level residents who are on call, and then you round on the patients, either who you did procedures on or who are going to have procedures done, and you go home around 7, 8 o'clock. You get home. A day two could be, a more relaxed day.
Sorry, doctor. Will you mind maximize your screen, your PowerPoint screen, please? Thank you. Thank you so much.
Oh, so a day two could be that it's a more of a relaxed day. You come to the hospital around like 8 o'clock, like 7:45. You round with your with your team. You have clinics that starts at 9 o'clock. You do a couple of sedation cases, local extraction, follow-ups, and then you get to go home at 6 o'clock. But it takes time to get to this level. I mean, this is my 6th year of doing residency, and this is my schedule right now. But when I was an intern, it was much different. You have to get to the hospital around 5:30, or maybe, if you're not on call, and you have to pre-round with the resident who's on round, or at least do a chart check on everyone's vitals, and any updates in their notes. Round, work in the clinic. In the clinic, you could see as many as 20 to 30 patients, and then you have to do notes. That's the bane of every single resident's existence, doing notes. After you're done with a busy day, you have to sit down for 2.5, 3 hours and do notes. And then if you're on call, and if you have to stay in the hospital, they have to see the patients who had surgeries done, like a post-op round, and then you have to write notes on them. And if anything that comes in overnight, you have to see those patients. And next morning, you just have to be ready to continue and do the same thing. So a typical dental case that is seen in private practice, seen in a residency when it's, I would say, a relaxed day, is wisdom teeth extraction. See how these are impacted wisdom teeth. If you guys have them, I highly encourage you to get them removed. And it's only harder and harder the older you get to get them removed. Or something like this, I'm sorry, I don't have a dental panoramic radiograph, but putting these dental implants in. That's a very typical bread and butter private practice oral surgery day in the clinic. You put your patients to sleep, you give them some medications, you do the outpatient surgical procedure that's needed, and then get up, they go home, and you do this type of procedure like 3, 4, 5, 6 times a day, because you have 5, 6 patients in a day. So next case, just gonna give you a little heads up. It does include some blood, and if you, it's a little gory, so I do apologize, but I feel like it's very important to show you what it encompasses, because in the end of the day, this is an oral and maxillofacial surgery. So this is a trauma consult that was seen in the emergency department. So please be ready. This is a 3D reconstruction of a CT scan, and you appreciate how there is these line of fracture right here. You see this line. It's someone who got punched, was assaulted, allegedly assaulted, and sustained in the fracture. This is called the Fort 1 fracture. It's actually pretty high for the Fort 1 fracture. Usually they go around right here. But when trauma happens, it's unpredictable. So yes, the next 2 slides are bloody. Okay, so just FYI. So you see this laceration right here. It's a cut that was repaired. This was repaired by one of my 2nd-year residents. So this is a very common thing that you would see in the ED when you're on call. Sometimes at middle of the night at 3 o'clock, or sometimes at 5 o'clock in the afternoon. And then, we're expected to repair this, and to the same standard as a plastic surgeon. Then we went ahead and took the patient to the operating room, showed you the fracture on the CT scan, and you appreciate how this line right here and this line right here, we went ahead and stabilized these with some mini plates. You hear about your orthopedics, your football players, how they have a rod, or they had their tibia or their fibula stabilized by a plates. So their any type of arm fracture. But us as oral maxillofacial surgeons do pretty much the same thing. We use a much smaller screws, much smaller plates, but in the face. Next is an orthognathic case or a jaw correction surgery. I'll put the pre-op workup up, and I'll talk more about this. And you've seen people who are who have overbite or overjet, and that's not able to get corrected by braces only. This patient right here is what they call as open bite. When they put their back teeth together, which you could see are occluding or they're touching each other. There is an opening right here. That's and that you can't eat a salad. When you're smiling, you can't. It's not aesthetically appealing. It's not functional. So what do? We do a procedure for them for jaw correction surgery. We go ahead, make an osteotomy or make a cut into their upper jaw. This is pretty similar to the Lafort 1 fracture, but instead of having a fracture, we create a fracture by, using your drills, your saws, and things like that. And this is how it's guided, where we're gonna make our cuts. We go ahead and make these cuts, stabilize it with a custom plate, and our goal is to get the patient into a bite where they're touching their teeth, so they're able to function and chew in a more aesthetically appealing manner. So this is another workhorse of oral and maxillofacial surgery, jaw correction and orthognathic surgery. And if you're a dental student, you probably have heard about it or know about it. And if you are a pre-dental, I think this is something very important to know and see about and learn about before talking about oral and maxillofacial surgery. Next case is something that doesn't happen on a daily basis in our specialty, but I would say maybe once a summer, once a winter, things like that. It's what I call a pan-facial fracture. This patient, poor guy, fell from third floor and literally smashed his face in multiple fractures. You see this line right here. You see this line right here. His forehead is fractured. His eye sockets are fractured. His side of his jaw is fractured. His nose is pretty much smashed in. So this person needed a surgical repair. Again, FYI, next couple of slides are gonna be bloody and just some advice on just being cautious. So how do we fix this fracture? You see, we had to make this incision line. We first marked it. We're gonna go ahead and literally peel this skin all the way down to reach this forehead right here, because otherwise you don't want to make a cut on anyone's forehead and leave a scar. That's why you have to make this cut in the hairline. And again, remember, we are oral maxillofacial surgeons. We are, by training, dentists. But, our specialty has gone so far and so ahead in training and learning and providing a service that we are able to do these type of procedure. So this is the jaw fracture. Again, some mini plates put on, some screws, right? Slide. We could make a cut on the skin, go to the skin to put another plate on. But this is the image I want to show you. You see the skull. We literally peeled it open to get access to this fracture to fixate it. And this is here, it's fixated. So, and then we went ahead and fixate the eye socket. So what I want to say is, if you have someone who tells you that, there are limitations, there's always limitations that could be pushed. Us as oral maxillofacial surgeons are able to perform these type of procedures. So you as a pre-dental, you as a high school student, or you as a dental student, you have all the potential. You just have to push yourself and push the envelope like the forefathers of oral surgery did. And instead of just going from working in the mouth, they work on the face now. And again, this is the pre, this is the post. You look at how this patient was fixated with multiple plates and screws. The part that was fractured in is now stabilized with these plates, and we were able to do this because of our training, because of our education, and because of our passion, because of our interest. We didn't let people stop us. We went through organized dentistry. We worked hard and we acquired the rights and the privileges to do these type of procedure. Now I'm going to turn it over to the moderators. And again, guys, if you have any questions, please feel free to ask them. I hope this was a little bit informative to give you an insight of oral and maxillofacial surgery in at least USA. Please go ahead if you have any questions.
Okay, perfect. Thank you so much. It was very informative. We have a couple questions that I'm just going to read off. So starting with number one, congrats on almost completing your residency. What exactly does residency entail?
So my career, my path was a little non-traditional. I graduated dental school and I wasn't top of my class, so I did an internship in Chicago. That was basically an year where I just got to learn about hospital oral surgery, taking calls, helping out my seniors, and just trying to build up my CV, build up my scores, and help applying. And I did apply. However, I didn't match again. So I did another year at Brooklyn Hospital, pretty much the same thing, but this year I matched. Oral maxillofacial surgery in USA. Again, it's 4-year or a 6-year track. I'm in the 4-year program. So, out of 4 years, you spend 4 months in anesthesia, 2 months on internal medicine, and 4 to 5 months with general surgeries to encompass all aspects of medicine into your training. And of course, at least 2 to 3 years of your training is on service, they say, which is on oral maxillofacial surgery. Beginning years of your training, you learn how to take out teeth. Then you slowly progress to wisdom teeth. Then you do dental implants, any type of surgeries that are included in the mouth, including biopsies or grafting or any type of procedures. In your 3rd year, you start going to the operating room where you start learning about mandible fractures, you start learning about facial fractures, orthognathic surgeries, cancer surgery, and in your 4th year, you're the one who is doing them. Of course, there are some subspecialty of oral maxillofacial surgery, such as cosmetics, cancer surgery, reconstruction surgery, that requires another fellowship. A fellowship could be a year to 2 years. I do not plan to pursue any fellowships, but there are a lot of people who do, and which really helps them out and trains them to be a much better surgeon.
Perfect, thank you. Another question is, how many classes do you usually take at once in dental school compared to medical school?
I do not know what classes you take in medical school. I can't really answer that question, but in dental school, I think it depends on which dental school you go to. My dental school, we had 4 to 5, either in the beginning, core science classes, and then towards the end, 3rd and 4th year was basic dentistry classes, subspecialty dentistry classes. The beginning years, you had pre-clinic where you would spend at least 2 to 3 times a week, at least half day in the clinic, just learning how to do fillings on a mannequin or doing dental crowns on a mannequin, and it translated into your 3rd and 4th year doing them in the clinic. Again, each program or each school is set up so differently that you have to look at their curriculums to better understand. It's not the amount of the quantity of classes. You have to take. If they give you 10 classes, you have to take it. If they give you 2 classes, you have to take it. I mean, you're pretty much at that point just a slave to their trade. You can't even tell them that I'm going to take 4 classes or 2 classes. You have to just follow the curriculum they have set.
Perfect. Another question is, can you go over how we can get involved in organized dentistry?
From the U.S. perspective, ASDA, or American Student Dental Association, which I was a huge part of in my dental school career, really helps students get involved. I think they have a committee which is for pre-dental as well. So I would highly encourage you to look at American Student Dental Association on Google. And I think it's asdanet.org is their website, if I remember correctly. And if you're a pre-dental, you could, start applying or start being involved in the pre-dental part of their organization. And as you get into dental schools, or at least in US, every single school has a chapter. And then, you slowly get involved, slowly see what they do and how they do it. And it's a big family. It's a huge family that comes together, helps out each other, networks. I mean, I know people in every different state just because of this organization.
Thank you. Another question is, what did you enjoy about working in a hospital rather than a private practice?
I believe hospital, you see some complex cases, right? And compared to prior practice, as the presentation, the first day or first dental case one, dental implants and wisdom teeth is, or dental grafting or any type of oral surgery. That's pretty much what you'll see in the clinic or in the private practice setting. But the later jaw correction surgery or trauma surgery, you have to be affiliated with the hospital. Right now, I'm in my training. So in the training, you have to be affiliated with the hospital. I am joining a private practice in a couple of months. But my goal is to always be affiliated with the hospital so I could retain the surgical skills that I spent 6 years acquiring. And I just really enjoy what I do. I'm really passionate about it. So I feel like you have to do a hybrid model and be involved in both.
Thank you. Another question is, do you know if dental schools hold a specific weight in terms of how many different extracurriculars a student can be involved in?
They do not specifically, at least my school did not, but you have to be in good academic standing. End of the day, you have to pass your classes. You have to make sure you move on to the next year, and that's really important because, of course, dental schools are very expensive these days, and you do not want to waste, or you do not want to spend a year repeating just because if you want to do an extracurricular during dental schools. As far as if you're applying as a pre-dental, um, I personally want to say that you have to show yourself as a complete student or a complete candidate. They want someone with personality. They want someone who is able to accommodate or juggle some school work, extracurricular activities, community service. Someone who's involved. I don't think that you need a CV full of 10, 20 extracurricular activities. If as long as there's something that you're passionate about and you're doing it, just for the sake of that you enjoyed and not just to build your CV. I think that's more important than having the numbers itself.
Thank you. Another question is, when applying to dental school, is it better to have more work experience or volunteering experience?
Good grades. Good grades get you in. If I could tell anyone anything, I would get you grades. If you're applying to U.S. dental school, you do your DATs, your high school grades, your undergrad grades, and your DATs. That makes a big difference. As far as work experience and shadowing or volunteering community service experience, it helps, but it's not going to get you in. Your grades are going to get you in.
Perfect. Another question is, are you planning on pursuing an MD as well?
I am not. I spent 6 years in residency. I am married. I have a baby, so I have family obligations. So I am not. But in hindsight, if I could do it all over again, I would definitely go for the MD.
Perfect. Another question is, should I apply to dental school with a pass-fail grading system if I'm interested in OMFS? Would it be beneficial to apply to a school that has a joint curriculum with med school?
I think that really helps. If you're applying for oral and maxillofacial surgery residency in USA, you have to take this exam called CBSE, which is a mimic copy of Step 1s. So going to a dental school that has a medical curriculum, that would really help. Again, same thing going back, what's going to get you in? It's grades, numbers, and grades. I mean, it's sad that we emphasize so much on numbers and grades and not on passion, but that's how these directors differentiate candidates. If you need to go to, if you're planning to go to a pass-fail school, that's great. Go to a school which has a nice track, a good track of getting specialists or having their students become specialists. At least in the East Coast, I would say UPenn, Columbia, like those are some of the schools that I recommend if you want to do specialty only.
Perfect. Another question is, what makes a maxillofacial surgeon more interesting than an actual medical surgeon in your opinion?
Passion, interest, it's different. I mean, you can compare them because, again, medical surgery or in medicine, surgery encompasses everything and anything. Any part of the body you see, there's a surgeon for that. So what makes I mean, I want to say passion because you could be an excellent ENT surgeon and you could love what you do, and as long as you love what you do, that's great. I went into dental school thinking that I was going to do dentistry, do cleanings and fillings, and place implants and things like that. But somehow I fell in love with oral surgery. It's hard work, and as an intern, you were in the hospital for sometimes 2 days in a row. You didn't come home, but I was passionate about it. I really love it even now. And it's not just I just love the private practice aspect of it. I also enjoy the hospital or the trauma. One of my favorite procedures is a mandible fracture. So passion. That's the best answer I could give you.
Perfect. Another question is, what are some pros? What are some of the pros and cons for a 4-year versus the 6-year OMFS program?
The more education you have, the more doors are opened up for you. If you have a 6-year MD degree, the more letters you have behind your name, the more opportunities you're going to have. If you want to go into academia, if you want to go into a fellowship, such as cosmetics or microvascular reconstruction, some of those programs, they require an MD. Can you get in with a 4-year program? Sure, but when you're doing cancer surgeries or when you're doing these type of procedures, your colleagues are because it's just such a competitive field. You have ENT and plastic surgeons that you're working with directly, and they want someone who has an MD, so it holds a lot of weight in the hospital. If you were to do just private practice oral maxillofacial surgery, no, then I don't think it does anything. In terms of training is the same. 4 years, 6-year guys, there are programs that are 4 year and then 6 years, and each residents come out being trained exactly the same. And I feel very comfortable doing whatever a 6-year OMFS resident can do. Of course, with limitations, I do not have any expertise in areas where there's a fellowship required.
Thank you. Another question is, what is the most rewarding part of your job as an OMFS?
The best part is, you start in your intern year and then you're all the way in your chief year. You spend 4 to 6 years, taking teeth out, helping patients. In the beginning, you struggle to take out teeth. And when you get into your final year, you're actually pretty good at it. So then when the patient looks at you, we're like, oh, wait, it's out already? Whoa, that was quick. That's like the best part. I think that just like every time a patient says that, just puts a smile on my face.
Another question is there any way to fast track some courses in dental school?
Again, it's very curriculum based. Each dental school is specific in the way they are set. And they're not gonna let you fast track. They have 100 or 50 to 100 students. If you're trying to fast track, so are those 49 to other students who are trying to fast track. So they're not gonna let you do it. You just have to dance to their beat.
Another question is 3.9 GPA competitive?
Oh, that's amazing. Yeah, I had a 3.4 or 3.5, something like that. Again, 3.9 is amazing GPA. You're doing good. Just work hard, get a good score on your DAT, and then and good luck. And I hope you get into your school that you want to go to.
Okay, and the last two questions. The first one is, how many hours do you work in a week, and what do you do to distress and maintain work-life balance?
Very good question. I started my intern year working maybe like 100 to 120 hours a day. I would get to the hospital 6 o'clock. I would come home 7, 8, and those are days that I am not on call. And if you're on call, you just have to go back in whenever the pager rings. So I don't know how many exactly hours I worked, but as you advance in your career, things get a lot easier. Right now, I'm my chief year, so uh, maybe work 40 hours, 40 to 50, 40, 60 hours a week. Maybe, I don't know. But when I'm at work, I'm not even working itself. I'm more like supervising, making sure all the interns are doing things properly. And if they need help, I help them out. And if there's some cases that need to get done, it's much easier as you go on. So things change. As far as de-stressing, the biggest thing I said, take breaks. I've been married for 7 years, so I have my wife as my pillar. She's my support from starting from my residency to till now. Just biggest thing that we have together is from my intern year until now, that she would wait for me for dinner. I think that's like, you need someone who is going to be there and support you. So it doesn't matter if I come at 9 o'clock or 6 o'clock. We'll have dinner together. If I come at 11 o'clock, of course she probably ate, but then we'll just sit down together while I'm eating. Or it's I think that's really important, to have someone help you out and support you and understand. You need to take breaks. You need to do what you have fun doing. I like going to the gym. I like working out. So I try whenever I can to take some time and do it. Uh, Going out with friends. I know, like, as I advanced my career, before, my undergrad friends would always hang out Saturday nights. And in the beginning, I sleep was way too important to me than hanging out. But now, I'm starting more to hang out with them. Of course, workload is much lighter than it was before.
That's sweet. And the last question is, who contributes more and collaborates more with you, a periodontist or a prosthodontist, in terms of trauma, injuries, and cases that come to you in the hospital, or does it highly depend on the case?
Since both prosthodontics and periodontics are not hospital-based specialties, none of them. But there are some programs where they have periodontist and prosthodontist in a dental school setting, and a program is based out of dental school. I do not know if periodontists really contribute to any trauma per se. Maybe they do in the dental school, but at least I haven't witnessed this. As far as prosthodontists, if there's a cancer center and these are maxillofacial prosthodontists, they might contribute to some cases. But in my experience, I haven't worked with a periodontist or prosthodontist for trauma purposes. I work with them for prosthodontists for dental implants restoration purposes, but that's about it. If there's any more questions, I'm more than happy to take them.
So that's all. I just want to say thank you so much for coming and teaching us a little bit more about oral surgery. We honestly, as a whole, we all learned a lot. And I just want to remind everyone in this session that in order to earn your hours, please go take the quiz in our bio. It's going to be a 5-question quiz. And as long as you get a 3 out of 5, you pass. Thank you so much.
Thank you, guys. If you have any other questions or any other guidance or anything like that, you can always reach out to me. And I think Ellen could share my email or my Instagram handle, so make it easier for you guys.
Perfect. And everyone's saying thank you in the YouTube live.
Thank you, guys. You're welcome. Take care.
Thank you. Bye.
Thank you for joining us.